If you're dealing with sciatica or disc herniation at L4-5 or L5-S1, you know how quickly the pain can change. One moment it's just stiffness, the next, a small movement can send that sharp burning sensation down your leg. And while you may have tried stretches or online routines, most of them are not designed to relieve irritated nerves and can actually make things worse. After helping thousands of patients over the last 35 years, I've seen the same pattern repeat itself. The patients who actually get lasting relief are not stretching everything they can. They learn how to decompress the nerve, calm the disc irritation, and rebuild true spinal stability. When you do the right movements in the right order, your disc and nerve can finally start to heal instead of staying aggravated day after day. Keep watching because in a moment I will give you the 10 best exercises for sciatica and disc herniation relief. 5 will reduce nerve tension and create more space in the lower back. 5 will strengthen and stabilize the core muscles that protect your spine. The routine is divided into 3 parts. There'll be seated exercises, standing exercises, and floor exercises. This makes it accessible for anyone, no matter how limited your movement feels right now. You'll get the same safe progression I use with my own patients. When done consistently, many people begin feeling relief, sometimes within minutes. Each exercise takes only a few minutes and requires no equipment at all. And if you like, you can keep coming to this video each time you do them. Hi, I'm Dr. John Zielonka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. One reason sciatica and disc pain feel so confusing is that the people start the wrong exercises at the wrong stage of healing. We're going to fix that in this video. Some things are perfect for early nerve and disc irritation. Others are better once the pain settles. The routine you're about to learn is arranged so that you always start where your body is ready. So chair, then standing, then floor. You can follow the entire routine or begin with the chair exercises and move forward only when it feels right for you. Let's get started. Exercise number 1 is the sciatica nerve glide. So when we do the sciatic nerve glide, watch here as Tanya's going to start. We're going to start with the foot on the floor. Okay, that's actually going to give us some extra support. And remember, on a nerve glide, we've talked about this in past videos, is what we're doing is we're getting the nerve to glide back and forth. You don't stretch a nerve. It's not like you're pulling on both ends. So you'll see that the toes are moving towards Tanya, then they're moving away. We're actually getting the nerve to actually glide back and forth along its path. So you're going to do this 10 repetitions. You can do this anywhere from 3, 4, 5 times a day. I know people are told, well, let's go do our exercises, once a week or 3 times a week. If you're in significant pain, the more you can get some flexibility, the more you can do some pain relief in there, the better off that you're going to be. In the seated position like this, it should take a lot of the strain off, and we're just going to go back and forth 10 times with the heel actually on the ground to give it that support. That's the easier way to do this. Okay? And then as we continue this, so the nerve is actually gliding back and forth. And again, you're going to do 10 repetitions. You're going to do this. Most people who have this, they have this coming down one leg. You could certainly do both legs as well. So if that's the case, just rewind the video and go through the motions again. Now, the more advanced way of doing this, where are we at here now? Yeah. Okay. So on the last repetition here, and then what we can do is we can also pull the leg up and actually hold it off the ground. This is a bit more of an advanced move because you have to hold the leg, in place off the ground. So that if you're able to do this, again, the same motion, you're getting the nerve to be gliding back and forth through the area. And again, it's what I call not dabbling. Okay? Exercises are not something where you just go through the motions. You actually want to feel that you're accomplishing what you're trying to accomplish. You're going to want to go through the movements. And this is something you can be doing 3, 4, 5 times a day. It literally only takes a minute to do this. And then even with all of the 10 exercises we're going to go through today, you can get through this in 10 minutes. There's no reason that you can't be doing this 3 times a day. Minimum once, obviously judged by pain. We've talked before about the idea of a hurt pain versus a harm pain and so forth. So let's finish off with the sciatica nerve glide here. Exercise number 2 are the seated pelvic tilts. So just as in number 1 where we did the sciatica nerve glide, that was for nerve relief, the seated pelvic tilt is also for nerve relief. So remember, when we're talking about the pelvis, this is the pelvis, and when we do a pelvic tilt, we are either going in this motion or we're coming in this motion. So you're going to see Tanya's going to start to do that with the pelvis. Probably easier to see what's happening here, but we are getting nerve relief by getting this movement back and forward, right? Whether we do what we call an anterior pelvic tilt or a posterior pelvic tilt. Again, we're going to do 10 sets of this. We're going to remember to breathe while we're doing this. Okay? And again, it's one where you don't just want to go through the motions. You actually want to feel movement coming back into the pelvis. You know, feel that backward and forward movement. It's something where it actually should give you some relief when you're doing that. Again, you can do this entire set, 3 to 5 times a day. If the entire 10 exercises literally only takes 10 to 20 minutes, then why not do this morning, afternoon, and evening as we go through the movements here. What number are we on there, Tanya? So it's number 8. We're going to finish off with number 9, and then number 10. It's called the seated pelvic tilts in the seated position, ideal for nerve relief. Exercise number 3 is a seated march. So when we get to number 3 on our seated exercises, this is what we call the seated march. So you're going to see that Tanya's going to lift the foot off the ground. She's going to hold for about 4 seconds or so, and then she's going to move to the next leg. We're going to repeat this for a total of 10 repetitions. This is all about stability. And remember, as I've said in the other two, the first 2 exercises, we're not going through the motions. There's a lot going on that you may not see. So what Tanya's doing is it's all about activating the core. So we're getting what I call that abdominal hollow, where you're almost pulling your belly button up and in, but you still continue to breathe. Okay? So those two are not mutually exclusive. You can actually be contracting the glutes while you're doing this. You want to stabilize that whole area. That's where we get the stability from, is we're stabilizing the core while we're adding movement to that area. So again, you can see with each movement, it's a very deliberate movement. You're going to hold for a count of 4. You're going to make sure that you're breathing while you're going through this motion in here. You're going to make sure you're stabilizing the core. This is all part of what we call the seated march. It's meant to give stability to the area, especially for people suffering with any type of chronic back pain. Now let's move on to the standing exercises. Exercise number 4 is the lateral hip glide. Now with our first standing exercise, this is, as we said, number 4, the lateral hip glide. So watch here. What Tanya's going to do is first the arm comes up, then she's going to lean towards the wall, support on the wall. Now watch the movement at the hips as this happens, where we're literally gliding the hips. So we're going to do that movement back and forth. We're going to do this a total of 10 repetitions on both sides. So what we're doing, again, this is for nerve relief. You're about, you can't necessarily see Tanya's feet in the shot. She's about 10 inches from the wall, and you want enough that you can lean over, you support yourself with the arm, and then you're gliding the hips over towards the wall. Again, for nerve relief. Again, remember, you're still engaging your core. Remember, you are still breathing through all of this as well. So you should feel that nice movement in there. As I said, you're not going through the motions. You're actually focusing on what we're trying to accomplish here. And is that 10? And now we're going to do both sides. So Tanya's going to turn around. And again, watch the movement. She's still about 10 inches to a foot from the wall. Arm comes up, leans against that side, and then the movement is coming through the hip. And again, we're going to do the total of 10 reps on this side as well. So again, you want to feel that. You want to engage your core. You want to make sure that you're continuing to breathe as you go through all these movements. This is our first of our standing exercises. They're going to help with nerve relief. Exercise number 5 is the standing lumbar extension. All right, as we move into our second standing exercise, as we said, this is number 5, the standing lumbar extensions. So again, what we're going to do, watch Tanya here, she's going into what we call extension. So extension is bending backwards. What that does is that's going to take a lot of pressure off the disc. Remember, we've talked about this before, that the disc is like a jelly donut. So if you squish one side of the jelly donut, you're actually going to get the disc to bulge out on the other side. So you want to avoid flexion movements. Flexion is moving forward. So this is why we're moving backwards in this case. Again, we're remembering to breathe. The movements are very clear and precise. You're actually feeling what you're trying to accomplish in there. You are trying to engage the core as you go through these movements. This is the standing lumbar extensions. Again, you can do this entire series 3 to 5 times a day, at least once a day, obviously. But the more you can do this, the better off this is going to be for your body. Remember, your body's dealing with some serious issues. The more we can counteract that, the better off it's going to be. Exercise number 6 is what we call lean over the cliff. So when we're performing the lean over the cliff, that's exactly what we're doing. Pretend you're on the edge of the cliff and you're just leaning forward to look over that cliff. This is designed for stability. Okay, this is not going to give nerve relief. We're actually getting your muscles to engage to give you that stability. For a lot of people, this is actually a very difficult move to do depending on the extent of your injuries. Again, depending on the extent of your injuries, this will determine how far forward you can actually come. Do not kill yourself on this movement. Is the amount that Tanya's doing right now is an excellent amount of movement. Okay? As you progress, you might want to, advance that. Be very careful that you don't fall forward, especially if you have balance issues and so forth. Again, we're going to be doing 10 reps. Again, this is all part of the entire program where we can be doing this 3, 4, 5 times a day. Remember, we are engaging our core and we are breathing through all of these movements here as well. And we're actually gaining stability back to the area. Now let's move on to the floor exercises when you're ready for them. Exercise number 7, the supine lumbar decompression is what we call the 90-90 position. Now, as we said, number 7 is now moving in obviously into the floor exercises for those who are able to get up and down. If you're someone who can't get up and down, then obviously stick with the first 6 exercises, the seated ones and the standing ones. But when you're able to get down on the floor and to get safely back up, then we can move on to the floor exercises. Number 7, as we said, is the supine lumbar decompression, also known as the 90-90 position. And again, this is ideal for nerve relief. So watch what's happening is Tanya is lifting first one leg, then the other leg off the ground. You'll notice there's a 90-degree angle between her trunk and her thigh and a 90-degree angle between the thigh and the leg. So what we want to do is we want to hold this position. When we're doing this, we want to make sure that we're, again, engaging the core. We want to make sure that we're continue to breathe while this is happening as well. And this is great for nerve relief in this position. And then both feet come back down. Again, you're going to do this to tolerance initially. For you, the first time you do this, you might only be able to do this for 5 seconds or so. Okay? The whole goal is obviously we want to get to that point where we can hold this for longer and longer. But again, pay attention to your body. Remember, we're not going through the motions. We actually want to ensure that we're feeling some nerve relief in doing so. We're engaging the core. We're continuing to breathe. We're trying to maintain that 90-90 position when we do this. If you find that this is difficult on the head and the neck, then you can actually support that as well. Again, take this one to tolerance. This is a great exercise to deal with these types of issues. Exercise number 8 is the glute bridge. So the glute bridge is one of my favorite exercises. One of the reasons it's one of my favorite exercises is because so many people are walking around with glutes that aren't just weak; they're basically inactivated or inhibited. A great video to watch is what I call one of my videos, the 4 best invisible exercises when we talk about all of this. So what we're doing in a glute bridge is very simple. You can see the position Tanya's in, flat on her back, feet flat on the ground, and she's simply going to start to raise her hips, and she's going to contract those glutes while she's doing that. When she does that, she's going to remember to engage the entire core. She's going to be breathing. As you saw, she's going to hold that for about 5 to 10 seconds, then she's back down. Then she's going to repeat that again. We're going to go through 10 reps of this, so follow along. Do each of the reps. This video ideally is to follow along with each of the exercises, not just simply see how to do something. So that's a nice thing. You can replay this video over and over again, each time making sure you're going through the motions. That's why another one of the reasons why we're doing a full set of this. Again, it should all be part and parcel of an entire program. So definitely at least once a day, but ideally you can be doing this 3 to 5 times a day. The entire series should only take you 10 or 20 minutes. The glute bridge, obviously, the goal is to activate the glutes. It's designed to increase stability of the area. When you're dealing with the condition that you are, the more stable the spine, the better off you're going to be. So we're contracting the glutes. You should actually feel the glutes. And it's not just lifting your butt off the ground. It's something where you can actually purposely contract the glutes as you're doing so. We want you to feel the glutes as you go through that. Again, activating the core. Again, do not forget to breathe through all of this. Excellent. Exercise number 9 is the bird dog. So the bird dog is also an excellent exercise for stability. So watch here. You're going to be on all fours like this and watch what's happening. Tanya is lifting her left leg while raising the right arm, opposites. This is of key importance. This is when you have to be activating the core. You want to be activating those glutes. You want to engage the entire core. You want to continue to breathe. And now you've seen she's doing the opposite. Okay, this is an excellent exercise for stability. Now, again, this is more of an advanced move. If you're finding that what you're dealing with right now is incredibly acute, this may not be the exercise that you're ready for just yet. If you're that acute, chances are you weren't able to get down on the floor in the first place. Okay? But what we want to do is we want to be doing opposite arm and opposite leg. And we want to make sure that we stay balanced. You notice when Tanya does the movement, look how steady the core is. You're going to find a lot of people when they first start to do this, you're going to be wobbling quite a bit. Now, you're going to find it difficult to do that movement. Again, just take it slow. It will come with time. If you find it too difficult to do, then you may start very simple, where you may just start, with one arm at a time, okay, and then one leg at a time, until you can get yourself up to this point where you can actually get this balance, get this stability. This is going to be incredibly important for overall health and stability of the spine. Remember to breathe, remember to engage the core. And finally, exercise number 10 is the curl up. So when we're doing the McGill Curl Up, this is the last of our floor exercises, specific again to stability. So again, take a look at the position. Tanya's in, one knee is up, one leg is down. Hands are underneath the lower part of the back in here. And now as she starts her movement, look, she is curling up. Now this is nowhere near a full sit-up. Okay? As you're coming up, a small amount off the ground. It is so important that you are engaging the core while you're doing this. Okay? Also important that you continue to breathe while you do this as well. So you notice we're on rep number 3 now. Comes up, holds for a couple seconds, comes back down. You can see how taxing this exercise can be done depending on what level you take it to. But again, you have the hands underneath the small of the back to give some support. You have one knee bent, the other leg is straight. Okay? Continue to breathe through this movement. And again, definitely a more advanced movement if your condition is serious or acute. Again, if you can't even get up, or get down to the floor and get back up again, we're not talking about this exercise. But as we advance, we want to start bringing stability back to the spine. So you notice, again, to recap, 5 of the exercises were for nerve relief. 5 of them were more for stability in the area. Initially, we want to get the nerve relief, and then we want to bring some stability to the area. That's why it's important to do the exercises in the specific order that we have, and then also the order of going from seated to standing to floor. We would not, if we were in rough shape, we are not starting with the floor exercises. So Tanya's done the 10 on one side, and now she's doing the other side. So you can see now we have the opposite knee up, the opposite leg is down, the hands are still behind the lower part of the back. We are breathing. We are making sure the movement is smooth and precise. We're feeling that contraction. We hold, we come back down. And then we repeat that for 10 reps on this side as well. Again, what we want to do, remember, exercise should not be a chore. This should be something that you understand is beneficial to you. It should be bringing you relief. It should be bringing you stability. This is something we want to try to do multiple times a day if possible. If you made it through all 10 exercises, great job. And if you only did a few of them, you should still feel good about yourself. You now have a simple routine you can rely on that helps calm the nerve and strengthen the spine in a safe, steady way. Be sure to come back to this video and follow the routine again. This is how you get better at these exercises and how you progress from the chair movements to the standing and then to the floor. Tell me in the comments which exercise gave you the most relief. Was it the seated sciatica nerve glide or the standing lumbar extensions? I want to hear what worked best for you. If any of these exercises helped you feel even a little better, like and share this video so more people dealing with back and leg pain can find it. Remember to subscribe to my channel if you want to learn more tips and strategies for treating and relieving back and neck pain without drugs and without surgery. While these exercises can be very helpful for sciatica and disc herniation pain, if your symptoms are not improving, you may need professional care. Go check out this video where I show you how we treat patients with disc herniations, sciatica, and spinal stenosis using a method that has given our patients over a 94% satisfaction rate. Please watch the video now to see exactly how we do it.